Hi, and welcome to this recorded WebEx. I'm delighted to introduce Sachin Nagar, who's going to talk to you about his quality improvement project that he did in just 8 weeks after he participated in a quality improvement program with Health Education East Midlands.
Basically, I'd like to take the next few minutes just to talk a little bit about my quality improvement project, which I ran whilst I was working at the Leicester Royal Infirmary on Ward 19. My project was all about trying to reduce the time delays in stat medications being administered on the ward. Now, this was a problem that I thought was contributing to prolonged admission and therefore possibly causing harm to patients whilst they were on the ward and delaying their treatment, essentially. So to decide whether this was a real problem or whether it was just, a small issue, I looked on, I've made some observations whilst on the ward to decide how often this problem was occurring, and I found that it was a problem that was that I noticed every day whilst I was working on the ward. I looked further afield, and I found that there was some evidence available on the internet. The National Patient Safety Agency released an alert in 2010, just describing that there was a potential for significant harm when certain medications are delayed in the hospital setting. So to understand the problem a little bit better, I had a little think about and made some observations on the ward regarding some of the issues that might be contributing towards delays in medications being given. And there was a number of issues that I identified, but the ones that I tried to concentrate on, I guess, in my project were those associated with human error and communication. So my idea for change was to introduce whiteboards at the entrances to the bays on the ward to try and help assist with communication of when stat medications were being given. It was an idea that I got from seeing a similar system being used in the acute medical unit. So I ran a PDSA cycle. I started to collect some data of what was happening at the present time. I produced the charts themselves, the whiteboards, and I spoke to key members of staff to try and get them on board, and also to find out if anybody had any concerns about the project or of the intervention, and try and address some of these, and trying to get people to at least try the intervention for a short time. So after having collected the data, I produced a run chart, which you can see here. And as you can see, each blue dot represents each stat medication that was given over the time period which I ran my project. And there's quite a variability in the delay in certain medications being given, but there's a median line, which is the horizontal red line, and it shows how this changed during the project. So the first dotted dashed line, red line, vertical line, you can see is when I implemented my change. And as you can see, actually the median time interval for stat medications being delayed increased once I put the intervention in, and then subsequently when I left the ward, I was off the ward for a few days, it got even worse. And so this sort of highlighted to me that actually my intervention was unsuccessful, unfortunately. But when I reflected upon this, I could see that there was a number of reasons, but one of the reasons why this didn't work was because my intervention itself was easily bypassed by staff if they chose not to engage with it, and also that it was occasionally used as an excuse not to communicate verbally with other staff members regarding when medications were being needing to be given. So some of the learning points for me in this, having run this project, was that although it is important to have simple interventions and not to increase workload to try and to help staff engage with systems, it's also very important to ensure that the systems that you introduce and the interventions that you introduce are not easily bypassed, and to realise that if something's not working, just to stop, really. And also at this point, it allows you to reassess and maybe try a different intervention, which is possibly something that we could do in the future.
Okay, thank you, Sachin. That's a really fantastic project, and thank you for sharing it with everybody. I think the thing I like about this particularly is actually the learning from failure, which is something that we're not very comfortable with. As you pointed out, you could so easily put something in place that you think is a great idea, but unless you actually measure in the way you so clearly did, you wouldn't have actually known that. And you may have thought that the fact that people were just writing stuff up on the board was actually evidence that it was working. So it's a really brilliant project, a really fantastic piece of learning. And I wonder what your next step might be.
Yeah, thank you. I think, well, the first thing is to take those posters down because they're not going to the whiteboards down. But I think I think the next step would be to reassess what we could do next in terms of looking at perhaps deciding which medications are the most important and trying to decide whether we can address the most important ones first. So, for example, time-dependent medications that are critical, more critical for patients to receive on time, and try and break up the problem into more manageable segments, I guess. So I think there's a little bit more work to be done in terms of just trying to understand the problem a little bit further. And then perhaps once I understand the problem a little bit better, to be able to think of an intervention that's more suitable to addressing each one of those problems.
Okay, that's great. Thank you very much.